Thanks. Appreciate you guys giving me an opportunity to come out and talk a little bit about allergies and asthma. My name is Mark Corbett. I'm an allergy with Allergy Care in Louisville. Our main office is over on Eastern Parkway in Boston. We have about 6 or 7 in town, all across town, South Bend medical area. So we'll go through the slides quickly, and then should have plenty of time. If you all have any questions about allergies for you or your family members. Slide's not going on.
I'm sorry?
Next slide's not going on.
It's not going?
Yeah. You get that. Technical difficulties. There you go. Okay, so what we'll talk about briefly is what is asthma actually. Second, who's most risky to get asthma? Does your environment have anything to do with asthma in your home? And how can you reduce exposures to indoor asthma triggers? So what is asthma? Well, asthma is a chronic inflammatory disease of the lungs. So one problem I have with my patients with asthma, you put them on their inhalers, and tell them you take that every day, and they all quit when they start feeling better because they're not having any trouble with their asthma. But I tell everybody asthma is just like high blood pressure. You have your high blood pressure every day, you have asthma every day, so you really need to stay on your preventative medications. So that's probably our biggest battle as doctors. It is treatable, but not curable, although in some cases we can cure it. It's not the same as allergies, but allergies can cause it. So you can have asthma without having allergies. And I'll tell you, in kids, about 70 to 80% of children who have asthma have an allergic trigger. Adults, probably around 50% range. It's not contagious, of course, but it can be life-threatening. We have about 3,500 people a year die from asthma. But thankfully, they're very elderly, and there's a few, there's very small babies. So our age group in this room, if you take the medicines, it's a pretty well-controlled disease. About 17 million Americans have asthma, and about 7 million children. It's the most common chronic disease of childhood. Louisville is one of the most challenging cities. We always finish in the top 5 when you're rating allergies, and asthma goes along with that. It causes more hospital stays than any other childhood disease, and a lot of lost work days for parents. And if you have an asthmatic children, you know you have to take off, stay home with them sometimes. And so leading cause lapses. And who's at most risk? Well, again, really anybody but children, especially low income and urban residents, minorities, African Americans and Hispanic are a little bit more likely, allergic individuals, and people with a hereditary disposition for asthma. And I would really say more hereditary disposition for allergies. So parents have allergies, child has more chance of having allergies than asthma. So what happens with asthma? Well, basically, a couple things. You get the inflammation. So you have a normal lung on the left here. But because of the inflammation, again, from allergic triggers or other triggers, you get swelling of the airway, increased mucus production. So when asthmatics have an attack, and you cough up a lot of mucus or sputum coming out. And basically, the muscles around the lungs sort of clamp down and squeeze the lungs. So asthma is sort of like trying to breathe, go out and run, as fast as you can for 10 minutes and then try to breathe through a straw. Sort of if you can't get the air, you really can't get the air out, it's a big problem. Again, the airway narrows caused by the tightening of the muscles around the airways, swelling of the lining, and increasing mucus production. So what are the warning signs of asthma? Basically coughing. And I'll tell you, in kids, a chronic cougher, he coughs all the time, or he coughs every time he gets sick, that almost always is going to be asthma in a young kid. So if you have a kid or grandkid or whatever that's doing that a lot, it's not bronchitis, it's not allergies, that could be asthma. So pay attention to that if you have one that's coughing all the time. Wheezing, of course, fast breathing, poor skin color. And this is what you're going to see when you're really in distress. You need to be in the emergency room with that. Shortness of breath, hunched over posture, restless during sleep, fatigue, again, space between the ribs. You'll see this in little kids where the ribs will sink in their skin, but that's, again, only when they're really severe. And then, of course, anxiety, and they can vomit sometimes from the coughing. So, as we mentioned, all those signs, wheezing, chest tightness, shortness of breath, and coughing, but that doesn't necessarily mean it is asthma, but those are signs that it could be. And again, as I mentioned earlier, the best thing to do with the asthma is not, I always tell my patients, I don't want to treat your asthma, I want to prevent it. So you put them on either, you can do it mostly with inhalers, but there's some pills you can take to help prevent asthma in some cases, especially in kids. Control your environment, so if there's triggers, animals, dust in the home, when cockroach, actually, mouse we're starting to find is a big trigger in homes. And unfortunately, every house has probably had a mice and they've had cockroaches in their house. Other triggers include exercise, respiratory issues in cold weather, And there are a subgroup of patients, especially kids, who only have trouble with their breathing. We call that exercise-induced bronchospasm, so they only do it when they're exercising. And now we'll talk a little bit about environmental. So allergens include molds, dust, animals, pollens, rarely foods for the asthma, and then of course cockroaches and mice, as we talked about. Other irritants, and again, working where you guys are working here, some of these come into play. Smoke, obviously, if you have an asthmatic in the house, there should be no smoke in the house. And you can't go in the back room and turn the fan on in the bathroom and smoke, or go to the other. That's not going to help. You really have to get the cigarette smoke outside, and you don't want to smoke in the car either. That's very important. So I know it's tough to quit smoking if you're in that situation, but again, it's very important. Strong odors, chemical smells, ozone, cleaning compounds. So you guys, I see there's welding back there, so fumes and things like that can also exacerbate asthma. For kids and adults too, viral infections are the big trigger. So a lot of times they get sick in the winter is from when they get a cold and it drops right into their chest. That's why I was saying if you have a child that every time they get a cold they cough and everything, you got to be thinking maybe this could be asthma. It's not just cold or bronchitis. Flu bug is a big trigger, and again these also get worse at night. We talked about exercise and then weather changes. Some people they think they have allergies because they come in the spring when the weather's going crazy and they have flares of their breathing or they flares their allergies, but a lot of times it's just due to the huge changes in the barometric pressure and the huge changes in temperature can set people off. Indoor air pollution, again, big problem because 90% of the time we spend indoors, especially now with the kids with the video games, they're all parked playing those, and we can get toxic levels of mold and other pollutants indoors. And again, a lot of these indoor triggers, a lot of these indoor issues trigger asthma. And your most important ones are secondhand smoke, dust, mold, pets, and cockroach. Other things that can be the vapors from cleaning solvents, so bleach, paint, mothballs, glue, anything that puts on a strong odor can irritate you, deodorants and perfume, bleaches, and other cleaners. So if you've got an asthmatic in the house and you're going to do that, clean the oven or whatever, you get them out of the house that day, have them go somewhere else. Again, not all triggers affect every person, so basically if you know you have a trigger, identify the problem, control the source, and then get rid of the pollutant if at all possible. So moving on to allergies now, and picture here for those who can't see, basically somebody sneezing, you've got a dog, and that's looks like ragweed there, and then mold over here. Pollens are typically transported by wind. One mistake, I wouldn't say, but one misconception is people go out in their car, especially when you go down further south, and you get all that yellow pollen on your car in the springs. That's pine pollen. That's typically not a problem because it's too heavy. That's why it's falling out and you can see it on your car. So when the pine pollen's out, but the oak and the other pollens, which are light, and they float in the air, and you can breathe those in. So those are the ones that are really causing the problem. It's not likely to be pine typically because it's too heavy. Grass, ragweed, birch, pine, oak trees can get indoors. So what we do recommend in the spring seasons, in the fall, with ragweed around here, close your windows. You don't want a beautiful day, open the windows up. Nope, run your air conditioning, close your windows if you have an allergic patient in the home. The other thing you should do if you have animals that are outside all day, try to wash them more often. And when the patients are outdoors playing, the kids should come in and take a bath at night and wash their hair because you get all the pollens in their hair and they go to sleep and it flares them up. Secondhand smoke, we've talked about that a little bit, just so many chemicals in the smoke, particularly bad for children, and definitely can trigger asthma attacks. It also causes upper respiratory infections, causes chronic ear infections. So if you're a smoker and you have an allergic patient or a sick child in the home, you really need to work hard to get that out. And I always tell my parents also, look, try to quit smoking, but I know that's not easy. Go back, an old jacket, don't put it on when you go outside smoking, pull it off and hang it outside. So basically, because the smoke gets absorbed in your clothes too. Dust mites, too small to be seen, but they're everywhere in the house, mainly in your bedding. They feed on your dead skin cells. That's a nice thought. The droppings are actually what you're allergic to. It's not actually the dust mite itself. It's the dust mite stool that dries up. You breathe that in and it causes the inflammation. That's a nice thought also. For the dust mites, basically, a couple of things you can do that are really important. Get yourself a cover over your mattress and your pillow, an allergy-proof cover. It just seals up with a zipper around your mattress and pillow. You can actually put a piece of tape across the zipper and really seal it up good. Do the same thing for your pillows, both your pillows and if you're in for the spouse, do both all the pillows on the bed. Wash the bedclothes every week, preferably in hot water, but just washing every week. The sheets, blankets, and pillowcases can be helpful. Getting carpets out of the room is important. Those are the three things that really we know in studies have been proven to be effective. You notice I didn't say anything about special air cleaners or anything like that. If you have a lot of money you want to spend and you want to go get an air cleaner, fine. but it's not going to do much for dust. Same thing with these ads about get your ductwork clean for dust. It's not going to help that much for dust because we talked about they're small little bugs and they're crawling around in your mattress and your carpets. They're not floating in the air. And I tell everybody, you want to sort of get an idea, take your pillow when the sun's peeking through your window and smack the pillow and you see all the stuff, blow it all stuff apart. That's sort of the dust mite concept. It's falling to the floor. So the air cleaners don't spend a lot of money on that. Don't spend a lot of money on a filter system for your furnace. Just get a basic filter and change it regularly, and they'll do a pretty good job. Keep the humidity down. That's also important. We know if you go into the mountains, you know, they don't have dust mites in the mountains because it's too high. There's no humidity. They have to have humidity. So you want to keep your house a little on the cool and dry side. We talked about these things here. So what about animals? It's the skin flakes. Could be the urine or the saliva where the allergens exist in the animals, and any warm-blooded animal. So dogs, cats are the main one, but you know, ferrets, any of those kind of things, and birds certainly can be an issue. We know that, especially for cat, if you move into a home and they had cats before and say you have an allergic patient, 6 months the cat allergy can hang around in the home. So if you do that, you really need to wipe the walls down, steam clean the carpets, and do everything you can to get the allergen out of the home. If patients are allergic to cat and dog, I don't even try to tell them to get rid of the cat and dog because they're never going to do that. They'll get rid of the spouse first. Or get rid of the kid. So the point is,
I'll pay you to tell my wife to get rid of the cat.
Yeah, I do that. Yeah. No, but the point is, definitely try to get it out of the bedroom. Try to wash it more. You know, the more you bathe them, it cuts down on the allergen a bit. And then, you know, and I always tell them, look, if the cat or dog dies, you know, don't get another one. You know, until you know that the child's or you're doing much better. Mold's everywhere. Mold gets a lot of negative press, and you know, you hear all these articles about mold. You know, but mold is everywhere in the environment. It's in homes and outdoors. If you're allergic to mold or have problems, treat the mold. So basically, if you have a moldy area, you want to bleach the area. And you can read about remediation on mold. But if you have a flood in your home and you got water and it got in the drywall's got to go. You have to get it out of there no matter what you do to dry it out, because what happens is it gets moist, and on the back of the drywall behind the wall where you can't see, the mold will start growing. You can really have some significant amounts of mold grow back there. Same thing with carpets. Carpet gets wet, it needs to be pulled up, carpet pad completely ripped out and replaced. You can try to dry the carpet out, and usually you can, but the pad you'll never get completely dried out, so you need to replace the pad. All this black mold has been in the media and about all these issues, but it's very unlikely that it's truly a problem with allergies. It's usually an irritant, so if you have it, you get rid of it, but you know, a lot of people come to us like, this black mold's causing me to have all these problems, and scientifically, it's really hard to prove that. So if you do have mold in the home, and basically flooded basements or damp basements, bathrooms, you know, those are areas like, I don't know if anybody still has carpet in their bathroom. That used to be a big thing in the 70s, but it really isn't a good idea anymore. And then any other leaking problems, try to get them taken care of. The other thing about mold is if you have a lot of paper stacked in the basement, you collect books, sometimes those things can develop mold too. So we talked about keeping humidity low, fixing the plumbing, and emptying and regularly cleaning refrigerator drip pans. Other things to do, run a bathroom fan when you're in the bathroom or the shower, control moisture in crawl spaces, air conditioning. And then if you're going to clean up, it's a half cup of bleach to a gallon of water. You apply that and let it sit and let it dry out really good. Cockroaches. Cockroaches we found probably about 15, 20 years ago, they're also a main indoor allergen, and everybody's house has had cockroaches. So I basically tell my parents and patients, treat it like it's your dust, so just keep the house clean, and you want to dust to keep the dust levels down. But if you actually have roaches, get somebody in to spray for them. And we can actually treat for roaches. If you have to go on allergy shots, we can add that in, believe it or not. So avoiding pests, everybody knows basic things. Keep your kitchen clean, keep the food sealed up and put away. Don't leave a lot of things sitting out. Again, we talked about air cleaners, really a last resort. If you want to spend a lot of money, a HEPA cleaner is probably better than the ozone generating cleaners. And we know the ozone generating cleaners can actually be a problem with asthmatics. So you really don't want to get one of those ozone generator cleaners if you have an asthmatic patient and put it in the bedroom, because you can increase ozone. We know that's an irritant for asthma. So get a HEPA unit, replace it as per directions, and that's about the best thing you can do. And again, I wouldn't recommend spending a ton of money unless you have some circumstance your doctor recommends it for you. So we talked about controlling asthma in the home, control the environments, dust, pests, mold, smoke, and strong odors, and cleaning solvents. What else can we do? Well, medications, of course, variety of different medications for asthma, inhalers. There are pills you can take. The important thing, as we mentioned earlier in this discussion, is they need to take the medicine. It doesn't work if it's sitting on the shelf. And if you wait to take it when you need it, that's usually too late. So again, you need to be on the medication on a routine basis if your doctor recommends that. If you still are having trouble and you do have allergies, you think about this, allergists can check you. There's a variety of different people doing allergists, ENTs will do it. There are some family doctors. I've got personal bias because I trained in allergy for 2 years on top of training in pediatrics, and nobody else you would see beside a board certified allergist has spent that much time researching allergies. So the other people do it, but they're not quite as, in my opinion, not quite as expertise in that. So I would suggest seeing an allergist. Get your skin test, performed. Skin test is pretty easy. It's just literally we take toothpick-like devices and you scratch on the back. If that doesn't show anything, we'll rarely do a few little tiny TB tests, a little sting on the arm. So I tell people if you had a tattoo, sort of like that kind of approach. The back's relatively minimally painful, and the arm can be a little painful, but it's done pretty quickly. Get your results that same day. And actually, some people get allergy done through blood, but I don't think it's quite as good because the skin test, you're actually putting the allergen on the skin to see what's going on in the system. And you can get it on the blood and get a lot of false positives. So if your doctor does blood tests and you come back with, 20 foods, you probably aren't. So that's really where you need to sit down and talk with an allergy specialist and really figure out what's really causing the problem. If you are allergic, we can put you on allergy shots. It's a series of basically getting what you're allergic to. And we basically desensitize you with time. You start at a low dose, and you move up to a high dose. That's usually done a couple times a week, anywhere from 1 to 3 till you build up, and then you go to a maintenance dose, where you usually stay on it weekly for a while, then you space out until you eventually go every 4 weeks. Most people are on the shots about 3 to 5 years, typically, if they do well. I pretty much tell my patients when they start, half the time, my patient won't let me stop the shots because, they were so miserable before, they're feeling so good now that they, like to stay where they are. So it's certainly an option, our information there. And I think that pretty much handles it. Some information on EPA and American Lung Association. There's also an academy and a college of allergy if you want to look up information on the internet about allergies. They're pretty reputable. American College and American Academy. So I think we beat our time and have time for questions. Sir.
Can your body change what it's allergic to, or can you, you weren't allergic to this, but then 10 years down the road?
Yeah, you can develop. And I guess I'll say it for the microphone here. Can your body change what you're allergic to? And the question is absolutely. You can develop new things. Typically, when you start hitting 50, you're not developing new things. So as you get older, you usually won't, but certainly kids can change, things can get better, things can get worse. It's not likely that you're going to just completely outgrow things. People say, well, I outgrew my asthma. That very rarely happens. We know that it may go quiet for a while, but it'll come back later on. And actually, we know while it's not really manifesting itself, it can actually still be doing damage to the lungs. So if you've had asthma, family member has asthma, you need to be followed up every so often to make sure everything's stable there. But yeah, definitely things can develop. Food allergies can develop with time, and things can actually go away with time. Yes?
I was commenting on what he said. When I was a child, I was allergic to milk and eggs, and now it's one of my favorite foods to eat. Before I couldn't drink it. I used to have, like you said, to get shots once a week.
Right.
But now.
No, definitely foods can change. I'll tell you, milk and egg, actually, if you look at the foods that are the most common in kids, it's milk, egg, peanuts, soy, and probably wheat. You may throw fish in there too. We know that the milk and the egg, around 50 to 60% of the time, will be outgrown with time. So that's something, if your child has that, they should be getting checked every 6 months to a year, depending on the severity. Peanuts and pecans and tree nuts and fish, we don't typically get outgrown. Only about 1 out of 5 of them will outgrow it. So that's one, if you get when you're young, you're gonna probably have trouble, for a long time. And unfortunately, peanuts are the one that's usually the most severe. So interesting finding that was just in the New England Journal like 2 months ago, which is going to change. If any of you guys have little kids or grandkids, we know now that we used to say, don't feed them any peanuts, no egg or milk till they're 1, no peanuts, no fish till they're 2. And we're sort of thinking now with the new study that came out with peanut, that probably has been bad advice, and that's why we've got so many peanut allergies. So in the study, they took 3 to 9 month old babies, tested them to make sure they weren't strongly allergic to peanut, and if they weren't, they basically started feeding them peanut butter in some variety, like 2 or 3 times a week, and then they measured it about when they were age 5, I believe, the kids that got fed the peanut butter versus the kids that didn't get fed the peanut butter or the peanut products, and the kids that got fed the peanut products had a much decreased incidence of peanut allergy. So I think for those who have kids and grandkids, the recommendations now when they're 3, 4 months of age, just start shoving a little bit of everything. You know, my grandma always used to say.
Is that why you see more nut allergies?
That's what we think. Yeah.
Because growing up, you hardly see.
You hardly saw it again.
You can't send someone to school that has.
No, exactly.
It's gotta have a label on it.
Right.
It's gotta be homemade. It's gotta be.
Right. And I'll tell you, for those who have experienced it, if somebody comes in and tells me they're allergic to 20 foods, I immediately get skeptical on that. So that's one mistake I think that a lot of people, allergists or allergy specialists do. They'll test people to a bunch of foods and say, oh, you have 15 foods you're allergic to. We know that's very unlikely to be clinically true. There may be 1 or 2 of those that are clinically relevant. So you really need to have that information, review it with your allergist. And if your allergist or allergy specialist, I would say, whoever's doing allergy testing, and tells you, oh, you're allergic to 20 different foods. Well, I would question that. Because I mean, I think we can really restrict diets, inappropriately if we don't watch out. All right, counting up. Any other questions?
Thanks for the cookies.
Oh, no problem. Hey, thanks for your time. You know what? Your first thing? Or? Okay.